Nurses, doctors, or the ER, what are some crazy behaviors patients do that are more common than we realize? A common misconception is that yelling at or being snarky with the healthcare team will improve your loved one's care. It won't. We will still take care of them, but no one wants to go the extra mile if a family member is recording or belittling them. Here are a few more. Not disclosing contagious illnesses. Do not fail to tell the RN in triage that you have a contagious illness and only casually mention it later. I cannot tell you the number of people who come to the ER for an unrelated complaint and after being taken to a room will say, I had been sick 2 days ago, or yeah, I'm being treated for shingles now, etc. If you have a contagious disease, even if it is unrelated to your current complaint, we need to know so we can protect you and others. Expecting a dentist, being upset that we don't have an on-call dentist to remove your tooth at 3 a.m. I understand that infected or cracked teeth can be extremely painful, but dentists do not work in the ER. There are oral and maxillofacial doctors for facial trauma, but no one is extracting your impacted wisdom teeth. Lying about chest pain? Lying that you have chest pain because you think you'll get a room faster? You won't. You'll get vitals and an EKG. But unless either it is concerning, you'll continue to wait like everyone else. Not using a flared base. Alright, if you think yelling at the healthcare team works, you probably also believe the check engine light on your car is just a friendly suggestion. Story 2. I went into diabetic ketoacidosis last year and I was so confused. I was fighting and aggressively whizzing on myself. I came to, blind from the high sugar and in restraints. My husband told me what I had been doing and I desperately apologized to the nurses. I was met with empathy and one said, don't apologize, it was exciting. So if I got that nice reaction from my thrashing rage, I can't imagine how bad it can get. I spent 8 months on the transplant floor and it was very quiet compared to the ICU and ER. Story 3. Yelling at staff, patients or family members yelling at staff. Presenting with self-treatable issues, patients coming into the ER for things that are easily self-treatable, like throat pain, but they're eating Takis in triage. Calling for trivial issues, calling EMS for very minor things like a stubbed toe or tooth pain. Denial of substance use, refusing to believe that substances are the root of their issue, like hyperemesis caused by grass use, chest pain caused by incessant vaping, or cardiac problems from substances. Refusing to take responsibility for treatment, not picking up their antibiotics for a diagnosis we made a few days ago, then storming into the ER and demanding to know why they didn't get better. They never picked up the antibiotics for their UTI and now it's our fault that it has worsened into a kidney infection? Story 4. I used to work in inpatient psychiatric care and now work in the ER. I started noticing paranoid or delusional behavioral problems that are shockingly common, but people are walking around in normal society with these subclinical issues undiagnosed. Most diagnoses and involuntary holds only happen if they show these behaviors in front of the right people at the right time. Another issue is people who are completely ignorant of their bodies and what changes are normal versus abnormal. For example, no, the tip of your toe turning black a month ago is not normal, and yes, that is why we are now consulting with surgery to see if we can save the rest of the foot. Story 5. Assuming the answer will change, a common assumption is that my answer to your question will change if you ask it again, usually louder and more aggressively to the point of being belligerent. For example, can I feed my mom? No, sorry, your mom is currently NPO for a procedure which means nothing by mouth. She's receiving IV fluids for hydration. But she'll pass away without food, so can I feed her? No, not right now. Can I feed her though? My sister and my lord, I've said no 3 times. I've explained myself. Please stop wasting my time and yelling at me for doing my job. Thank you. Prevalence of hoarding. Another observation is the number of people living in hoarder homes. The number of patients we have come in from these homes is insane. And I know it's not just my area since I worked all over the province. I didn't actually know it was that common until I started nursing. Story 6. As an ER doctor who is board certified and practices full-time in California, I can tell you something that will get you downvoted on Reddit's r/trees faster than you can blink. Grass actually does have a lot of side effects. One particular complication we have begun to see far more frequently since legalization, which I support for the record, is something called CHS. To put it simply, chronic users, especially heavier and/or daily users, are at an increased risk of developing a syndrome characterized by shockingly severe abdominal pain and retching that is very resistant to IV nausea and pain medications. You can pump these people full of multiple nausea medications in numerous doses and they'll still be retching and miserable. Over the years, we found that the best treatment for it is actually an intramuscular shot of an antipsychotic medicine called haloperidol. Another effective treatment is to use clinically formulated capsaicin cream, the active ingredient in peppers that brings the heat all over the abdomen. Neither of these works well for any other kind of abdominal pain, but they are virtually the only things that work for CHS. Unfortunately, the only real way to prevent future episodes is by stopping the grass use. That, as you can imagine, is a tough pill to swallow for people who are daily users, and in particular, those who have projected their grass use as their entire personality. Story 7. I used to work the front desk triage at an ER and couldn't believe half the things people came in there for. One woman said she was looking for a primary care doctor at midnight. My thought was, this is an ER, not a primary care doctor's office. The number of grown men who had a cold or the flu and acted like they were dying was always funny to me. They would then become irate at how long they were sitting in the waiting room since it wasn't an actual life or death emergency. Alright, so nothing says I'm a grown man quite like needing an ER triage nurse for a mild case of the sniffles, am I right? Story 8. Refusing to be self-sufficient. Able-bodied adults of sound mind who soil themselves and then expect to be cleaned up to punish staff for not running to them instantly when their call light goes off. We saw you walk in here. No, we will not wipe the mess off of you. Do you whiz on yourself at home? No. Here's a pack of wipes, a fresh gown, and fresh sheets. If you'd like a shower, I can walk you down the hall. Waiting impatiently, people, usually family members or visitors who stand in the doorway or hallway glaring at staff because they've been waiting for a while. Yes, you are waiting. Yes, this is an inefficient system and there are plenty of things I wish were different. Every year there are staff cuts and funding cuts and we're expected to handle more patients than ever with less. Standing with your arms crossed and pouting at staff does not make the hospital run faster. Threatening to leave. Threatening to leave as if it will get you better service. There are 20 people waiting for your bed if you don't want it. Sign this form and there's a door. Have a good day. Leaving against medical advice and coming back to the hospital and throwing a temper tantrum when you have to start over again in the ER. No, we didn't save your bed for you. You wanted to leave. If you've changed your mind, please get back in line. Story 9. Well, I don't work in an ER, but I've been there a ton. I'm good at getting injured. No, I don't misuse the system. It's just always a last resort. This one time, I saw something insane that might fit the theme. I was in the waiting area, and it had already been over 30 minutes, which was fine. I had injured my hand and wrist quite badly and needed to rule out a break, but I was able to wait just fine. There were other people in the waiting room, including one guy. I don't know what was wrong with him, but he didn't look sick or injured. But what do I know? No judgment. Then in comes a mom, I assumed, with a boy no older than 10 with his entire lower leg wrapped in messy towels. He had a cut on the front of his lower leg, obviously something that might need stitches and at the very least needed to be cleaned to avoid infection. It was also something more pressing for a doctor to assess than my injured wrist. But this guy, who looked and sounded pretty fine, who had been there for a shorter time than me, started yelling. He claimed he had been there first and had waited at least an hour. I had been there a little over 30 minutes and had arrived before him. He was irate that they had taken the boy in before him. He kept insisting he needed to talk to a doctor and that there was a line. He still sulked after being told how an ER works, and I was called back to get my hand and wrist looked at. My teacher, who had brought me to the ER, being a minor and away at school, told me he even sent us dirty looks, but by his standards, at least I was there first. Story 10. Please research the hospitals in your area. Not all hospitals are the same. Know what services they do or don't have and consider this information when you decide where to go. This is particularly important for pediatrics. If you're a parent, please locate the children's hospitals in your area and have a plan to go there if needed. Many hospitals do not have inpatient pediatric units or a pediatric ICU. Look this information up before you are in a stressful situation with a sick child. If you have just had surgery at a specific hospital and you have a complication, please go back to the original hospital. A different hospital won't necessarily be able to view your records, and your surgeon likely doesn't have privileges there. In all these cases, if you cannot be treated, you will be transferred, which can take multiple hours to days depending on transportation, weather, and bed availability. Obviously, this is all location and situation specific. If someone is not breathing, go to the nearest ER. If you're rural, you might not have many options, but please do some research and be thoughtful about where you go. Story 11. I was probably one of the people described in these stories. I was very sick with my eating disorder and was made to go to the ER. I sat and I waited. When I was called in after my blood test results came in, they wanted to run multiple IV bags straight away. As soon as I heard the word glucose, I panicked. I tried to leave and refuse treatment because I was, quote, I was fine. The doctors and nurses tried to explain that I was unwell, but I refused to listen and was generally a pain in the I was put on a treatment order and was treated anyway and wasn't allowed to go home for a while. Now that I'm doing better, I realize I wasn't able to think clearly. I wish I had acted better and made the hospital staff's job a little easier. Story 12. 26 years later, I still feel horrible for telling off a nurse, but I kinda had a reason. I'd given birth to 3 babies and I am one of the rare women whose labors were less than an hour. Of course, the doctor was not at the hospital yet when I started to crown. The nurse told me I had to hold her in and wait for the doctor. Like, woman, my baby's head was literally coming out. I screamed, F you. I still feel really bad about it, but how did she expect me to hold her in? The doctor ran in 2 minutes later, barely having a chance to get in front of me. My daughter shot out at me so fast he had to catch her like a football. And yes, I once had a doctor tell me that the way my body is made, I was born to have babies. Story 13. I worked in retail pharmacy, so it was a little different, but people would leave the ER and 10 to 15 minutes later, they would pull up yelling about why their prescription wasn't ready. I'd take a look at the paperwork they would throw at me, and either it was for a narcotic, which was going to take a little time, or it was for an OTC medication like omeprazole, and they would tell me I was wrong. Thankfully, we didn't put up with that. If it got bad, we would call the hospital and then send them elsewhere or tell them to come inside and figure it out. I have zero sympathy for people who are mean to medical or retail staff. Story 14. I'm not a doctor, but I just got out of the hospital after 5 days. The nurses and techs were lovely and helpful, but the other patients and their families on my side of the floor were atrocious. The woman across the hall kept pushing the call button for trivial things like a straw or a new pair of socks because the ones she had were too slouchy. She also called for someone to find the next episode of Duck Dynasty for her on the TV. The person in the room next to me literally called in his entire family to visit so they could take turns trying to get free meals from the food staff. At one point on my last day, a very nice tech came into my room, shut the door, and I asked her what was up. She simply said, I just need a few minutes away from those people, and you're the only nice one. That's awful. It's awful that people treat medical staff this way. They're just trying to do their jobs. I'm not sure we'll have medical staff in 10 years if this keeps up. Story 15. ER radiographer, waiting time complaints. How long do I need to wait to see a doctor? I am so sorry, I don't know. Then go ask him. One patient, after waiting for an hour, left the ambulance to go feed his cat. He came back 3 hours later and was then ready to see a doctor. Unnecessary visits, paper cuts you can't even see, people who are unable to move, like an old man who got scared when you transferred him to the CT table and, because of that, grabbed your butt and chest. Disrespectful behavior, intoxicated men on a trolley sitting up and urinating on the floor or all over the CT scanner and table. Complaints about pain. I had to wait 2 hours for my x-ray. I'm in pain. This is a disaster. And in the room next to this, a young mother of 2 children who got hit by a car. I always offer to show them what a real emergency looks like. Be thankful that I am doing your freaking ankle x-ray 5 minutes after seeing someone who lost their life with a husband crying next to her. If you can walk in normally, it's not broken. Story 16. My younger half-sibling, who is autistic, ended up in the ER with a bad flu and seizure. My mom couldn't leave his side for days because of ADA issues. They had to sedate my sibling for an x-ray. Unfortunately, the x-ray tech woke him up while trying to get him into the proper position. And that was it. We couldn't get my sibling to cooperate once he was awake. This is a typical experience for families with disabled members. My mother and my sibling eventually moved to Europe and were amazed by how accommodating the local medical community was in their approach to disabled patients. For example, they had a dedicated nurse who lined up all the appointments in one exam room for a single day. All the medical personnel came in and out, and my sibling was able to stay put. Story 17. The number of people who don't understand basic anatomy or wellness is surprising. If you are constipated, go to CVS, look for the laxative aisle, grab just about every product, including the enemas, and go home to take care of it in your own bathroom. It's more private than having 2 nurses do it while you're on a bedside commode. Also, if you have a fever, a headache, or something hurts, try Tylenol or ibuprofen. Drink some water and wait. Paying $500 for some Tylenol or an enema in the hospital is just not worth it. Story 18. As a vet, not a human doctor, I've seen some extreme examples of people trying to self-treat things that really should not be self-treated. I don't know if this is an American thing due to healthcare costs, but it happens. I'm not talking about minor issues like debating whether to go to urgent care for a fever. I'm talking about a client who, during a vet appointment, showed me a photo of his Fournier's gangrene on his phone and asked if he should see a doctor because Neosporin wasn't helping. When I told him, dude, go to a human doctor, he then asked if I could prescribe him something for it. Story 19. I'm late to this post as usual, but I have family that have seriously irritated me in the ER. Not long ago, I took my uncle to the ER. He was complaining of chest pain, already had a pacemaker, and had previous open heart surgery, so I took it very seriously. Once we were there, he turned into a total schmuck. He complained about everything constantly. He got upset every time staff walked back out and closed the door behind them. And this wasn't them trying to annoy you, Unc. That's respect. He also complained because he wasn't rushed a warm blanket when he said, I'm cold. It took a few minutes, but that was not acceptable. In his mind, he was the top priority of the whole damn hospital, and the moment he walked in, he even got mad because of the IV placed in his wrist. I enjoyed that part, though. It took everything in me not to giggle while watching his face. Well, this place is just terrible. They don't give a damn about letting someone lay here and suffer. They're not fast enough. They've forgotten me. I should just walk out of here and go home. I've got to use the bathroom. How the heck am I supposed to go use it when they have me hooked up to all this crap? Go out there and tell them I need them to come help me. I'm about to cuss them out and tell them what's what. Yeah, this is not a five-star hotel or a fancy restaurant where people serve you. It's an ER. They're here to save your life. Testing takes time. You're not going to show them or put them in their place by being a douche canoe. As a matter of fact, these people have spent a great portion of their lives to be able to save yours, and you don't treat me that way, so why do it to them? I'm not qualified to save your life, and you don't treat me like dirt. They are qualified, and that's their job. Why do it to them? You're supposed to have one foot in the grave with how you were acting earlier, which is why we are here, and now your biggest complaint is how long it's taking or that they don't cater to you? Story 20. I'm not a medical professional, but I was a patient in the ICU for an extended period. When my family told me about some of my actions while I was delirious, I was so embarrassed. Besides removing IVs, my feeding tube, and trying to remove my central line, I told the nurses and doctors treating me that the only one qualified to help me was the custodian who had just walked in to change the trash. They told me later they thought it was funny, but I still feel terrible. I try to visit once or twice a year to bring cookies or baked goods. You nurses and doctors in the ERs and ICUs are truly something special. Story 21. I've had a patient's parents say they stopped the Miralax and now their child is having huge stools again. My conversation with them went like this. Why did you stop it? Because her stools were a normal size and didn't hurt. How long have her stools appeared normal to you? About a month. Before you started the Miralax, how long was she having huge, painful stools? Almost 3 years. When the problem started again, why didn't you resume what had been previously working? I don't know. How long do you think she has to be on Miralax for this not to come back? I don't know. Or the more common answer, well, she can't be on this forever. The child should be on it for about as long as she had the problem, so about 3 years. A pediatrician can then help slowly decrease the dose over a couple of months near the end of the 3 years. But yes, she can absolutely be on it forever if she needs it. Sheesh, poor kid. Story 22. Throwing a tantrum will not get you better care. I had a patient once who assaulted me when I told him he was NPO because he had a GI procedure the next morning. I actually scolded him like I would a toddler because that behavior is not appropriate. I had another patient refuse treatment because they felt they weren't getting good care. They expected to be catered to as if they were at a hotel rather than being cared for on a hospital floor. I simply told them that that was their right as a patient, and after a while, they stopped. If you want to leave against medical advice, that is your right, but you'll most likely be back within a week for the same worsening issue. And if you're enjoying the video, don't forget to hit that subscribe and like button for more videos just like this. Story 23. Yes, it's called the emergency room, but if staff feel that the only people not wasting time at the ER are those with minutes or hours to live, that attitude is unethical and frankly disgusting. Patients who wait until they are sick enough to be taken seriously, such as those with psychiatric conditions, who are often labeled as attention-seeking unless they are dangerously ill, may have higher in-hospital mortality rates due to that delay. They could have lived if they had been taken seriously when they were unwell, but not yet in critical condition. However, by the time these patients are close to passing, the ER has likely transferred them to a specialist service, which allows the ER to take zero accountability for its dangerous attitudes. Story 24. Calling 911 for an ambulance to go to a different ER. This behavior is not as uncommon as you might think. Patients will call for an ambulance to take them to a different ER if they don't like the wait time. Storming into non-patient areas, patients or family members often try to get into restricted areas either out of frustration with the wait or to try and get faster service. Threatening violence, legal action, or making accusations of cruelty, these are common intimidation tactics. Threatening to leave without being treated, the implied threat is that something bad will happen and it will be the hospital's fault. But people who actually leave have no backup plan and often come back later, sicker than before. The reasons for these behaviors are not that diverse. It's almost always the kind of person you're picturing, white baby boomers, and the most common reason is having to wait. If you ever go to the ER, be prepared to wait. If you don't want to wait, die. You'll go straight to the front of the line. But a caveat, as soon as you're no longer actively suffering, you could go back down the list. Story 25. Even though I only did a brief rotation in the emergency department, it was a very memorable experience. From my short-term experience, continuing substance use while in the hospital is shockingly common. I understand dependency, but the number of people who are admitted for coding and then coding again in the hospital bathroom a few days later is staggering. The same goes for the loved ones of those who were admitted for an overdose. I worked with one patient who broke into a church for shelter and coded. The patient was revived and admitted to the hospital, and that night their husband coded in the hospital bathroom. A visitor of the husband also went unconscious during a visit due to a coding. The original patient was transferred to behavioral health and coded again less than a week later. They all survived. I thought this was crazy, but it turns out it was not all that unusual. Story 26. This is something that happens far more often than the general public understands. Some people will come into the ER and suddenly lose the ability to perform basic self-care. We often see otherwise independent people who walk in and suddenly expect us to literally wipe their behind, or who strangely lose the ability to control their bladder and bowels. I'm not talking about people with arm injuries or illnesses that prevent them from doing so, but rather individuals who live at home independently with no assistive services. Story 27. Don't show up early for appointments. If you have an appointment for 1 p.m., don't come to the ER at 11 a.m. because you can't wait, especially when the issue has been going on for 2 weeks. You can't just rest here. Admitting someone to the hospital is very complicated, and the hospital is normally full. I know you're having surgery tomorrow, but it's 8 p.m. and you need to go home and come back. The ER isn't a diagnostic clinic. If you've been to 3 GI specialists and they can't figure out what's causing your symptoms, I won't be able to solve your problem in the ER. I can't reduce your symptoms and try to rule out 1 or 2 more obscure things that are probably not the issue, but you need to go back to those doctors to continue the process of figuring this out. Story 28. I'm here to complain from the opposite perspective. I was struggling to breathe even after using my rescue inhaler. The person helping me asked how many times I use it per month. I said I always run out before the refill. They then asked how many times per day that was. I replied, I get 220 doses a month. If I'm running out before the month is over, how many per day am I using? She said, look, I don't want to do any math. She wrote me an incorrect prescription for the wrong maintenance inhaler. They only caught the mistake because I responded to a survey about my list. I stated that she was unable to do basic math, told me she had no interest in doing so, and that because of this, I did not trust the prescription she wrote for me. Story 29. It is a common misconception that waking up to the nurse's station is more effective than using the call light. It's not. Here's why the call light is the best way to get help. It prevents the spread of germs. Approaching the nurse's station can spread germs, which is especially risky in a hospital environment. It ensures confidentiality. When you talk to a nurse at the desk, you could be sharing a patient's confidential information with strangers, as not everyone at the station is part of your specific care team. It ensures you get the right help. Using the call light directs the appropriate person to you, whether it's a nurse, a tech, or another member of the team. Your nurse may be busy with a critical task, and another team member can assist you with your needs. Hitting the call light helps the entire team. Secretaries or health unit coordinators can see how long the light has been on. A call light will alarm at the desk every 5 minutes until a nurse responds. If you press that button multiple times in a row, it creates an ongoing alarm that is disruptive for everyone. Remember that staff members prioritize calls based on urgency. A request for crackers will have to wait while a nurse is giving someone life-saving medication. If no one responds within 15 minutes, a supervisor will come to assist you and address the delay with the nurse. Please, just press the call light once. Story 30. The number of times a patient, or more often their family members, get physical with staff, especially nurses, is a huge problem. You can do everything possible and ensure good treatment, but at the end of the day, we aren't gods and people pass away. It's inevitable. Some family members react with anger and rage, screaming, "You've ended my dad, mom, sister, it's your fault, you'll go to prison," while violently starting fights, throwing glass bottles, and name-calling. I hate when it happens. You have to watch out for yourself while also trying to treat and support the other 59 patients. It's so upsetting that people behave this way, and that's what hurts me the most at work. Story 31. I'm not a doctor or a nurse, but I work in a hospital and have experience working with staff who were previously in the ER. The hospital where I work is the primary destination for mental health crises, so we often see people undergoing various forms of crises. Additionally, there are a large number of frequent flyers who come to the ER with the sole purpose of obtaining substance medications. Yes, the staff does keep a list of known aliases to either turn them away or to keep a closer eye on them. In fact, I was just at the ER tonight for a sudden rash thought to be from a recently prescribed inhaler, and there were at least 7 people there trying to score substances. One of them wasn't too far from me and kept asking the nurse for the good stuff, but she wasn't giving him anything. Story 32. It is common for hospitals to have regulars. I often see people repeatedly coming in with manageable chronic conditions because they are non-compliant or neglectful. I'm looking at you: diabetes, congestive heart failure, CHF, hypertension, and atrial fibrillation, AFib. Some of these patients get used to being fully cared for when they are super symptomatic and then refuse, and sometimes blatantly, to care for themselves. They can become nasty and entitled too. No amount of treatment or education changes the outcome, and we eventually see them pass away from the disease. It's very sad and in many cases, very preventable. Story 33. I have one, but it's from the other side about the emergency staff. I called because I couldn't eat or drink anything. I was retching everything back up, even water. The emergency staff on the phone asked, "Did you try to take paracetamol?" I replied, "I'm retching everything up. I can't even drink water anymore. I have a high fever and a constant headache that's getting worse. I need an ambulance because I'm by myself and I'm scared I'll pass out." The staff member said, "Okay, we'll get someone to you soon." When the paramedics arrived, they said to me, "Oh, is that you who needs an ambulance?" I replied, "Yes." The paramedic then said, "But you opened the door by yourself." I said, "Yes, I'm by myself, so who else was supposed to open the door?" The paramedic then threatened me if it turns out at the hospital that there's nothing wrong, you'll have to pay a £500 fine for calling an ambulance unnecessarily. At the hospital, I waited the whole afternoon and the whole night for a doctor. The nurses were ignoring and avoiding me. The next day, after they ran tests, it turned out I had salmonella poisoning and a kidney infection. I spent over 2 weeks in the hospital. My face was so swollen I could barely open my eyes. Story 34. You can get a non-emergency procedure right away. We often see people who come to the ER expecting us to perform non-emergent diagnostic tests, procedures, or even surgery because their appointment with a specialist is too far out. I can't do your shoulder arthroscopic surgery right here, right now. Online diagnoses and advice from friends are correct. People come in thinking they have a certain condition because they read about it online, or their first-year medical student nephew told them they needed a specific test or procedure. When we tell them they actually don't need it, they get flustered and say things like, "Well, I guess you're the doctor," with a look of disgust. My response is always, "Yeah, I am." An ambulance gets you seen faster. People take ambulances for things like retching or stomach pain, but you will not get seen any faster. They will simply drop you off in the waiting room and send you a $5,000 bill. Story 35. As an ER frequent flyer, not a medical professional, what comes to mind is how incredibly insane and aggressive people can be to the staff. It feels like almost every time I'm there, there's some sort of disruption where security has to be called because someone is screaming, having problems with authority, or making insane accusations. It's absolutely wild. People are entitled and pig-headed about the most ridiculous things. If they don't get their way, they will go full crazy person and start screaming. I'm not just talking about the elderly with dementia or homeless people with serious mental illnesses. I'm talking about middle-aged Karens and Kevins who you'd think are normal people until they start making threats against nurses and acting out. Story 36. Reading all these stories about the ridiculous things people go to the ER for, I'm over here on day 2 of excruciating abdominal pain that ebbs and flows after having laparoscopic surgery 3 weeks ago. I did the same thing during the lockdown when I unknowingly had appendicitis. The pain wasn't that bad and my ER copay was $900, so naturally I waited 4 days until I could get in with my PCP. She ordered a stat CT and I was sent to the ER immediately. This time I've hesitated to go because maybe I just accidentally did more bowel prep than needed. I'm afebrile and my lower abdomen is super taut with positive bowel sounds, so it's got to be fine, right? It can't be an ileus or a small bowel obstruction, and I've already had my appendix out. What else is left? The pain is anywhere from a 6 out of 10 to a 10 out of 10, screaming into the pillow level, but every time I convince myself to go, I think about how mortified I'll be if they say, "Ma'am, this is just gas pain, grow up and go home." But there are really people out there going to the ER to get a test for a mild flu or because their sneeze felt weird today. Maybe I'll go tomorrow morning. I think working in healthcare for over 20 years has made me the worst patient ever. Story 37. You should never apologize for asking questions. When I'm giving you a medication, I give you the highlights, the name, its intended effect, and common side effects. For example, this is Reglan. We use it for headaches, retching, and all kinds of stuff. Some people feel anxious or restless after they get it. I'll push it slowly to try to avoid that effect, but if you experience that, you'll know what's going on. And then you ask me questions like, what kind of medication is it? Any other side effects? Are you sure it will help? Sorry for asking so many questions. No, please ask me the questions. This is your body and your health. Ask me all the questions you need to understand what's going on so you can make an informed decision. If a question is above my pay grade, I can send a message to the doctor or the pharmacist through Epic. It's the same thing when I discharge you. I will tell you the highlights and the papers will have more information. The number of people who apologize for asking questions when I specifically ask for them is astounding. And that said, I have also heard a lot of coworkers complain about people who do that, so I understand why you don't. It drives me up the wall when they complain about that. You should treat your patients like they're people. Story 38. Faking pain in the ER. While I understand that everyone has a different pain tolerance and ways of handling pain, it is easy to pick out someone who is faking it. If you're acting fine while waiting in the triage line but then start crying as if you've been shot while in the waiting area, I'll have a harder time believing you. The same goes for if you complain about a long wait but went to a coffee shop 20 minutes away for a drink first. Story 39. I've had a very bad cut on my thigh that wouldn't stop for 2.5 hours before I was able to get to the ER. The woman at the desk asked what I was there for. I told her I had a bad cut that needed stitches. I had wrapped an ace bandage and a towel around my leg before putting black jeans back on to get in the car, and they were all soaked through. After waiting for about 20 minutes, I watched a young boy with a cough who arrived after me get seen before I did. The place wasn't packed, but there were enough people there. A nurse came out to take vitals while people waited. He came over to me, put a pressure cuff on my arm, and asked what I was there for. I said, I have a bad cut on my leg that needs stitches. He looked down at my soaked jeans and asked, is that red liquid? I said yes, that it needed stitches because it wouldn't stop. He said, what's wrong with you? Why didn't you say something? Suddenly, everyone was bustling. He started cutting my jeans off in the waiting room and I was hurried back to get stitches. I told him, don't cut my jeans, and he looked at me like I was insane and proceeded to cut up my favorite jeans. Story 40. Honestly, posts like this made me feel a lot better about the time I lost my mind at the ER doctor and nurses at 2 a.m. I had come in after taking Bactrim and started having anaphylaxis symptoms. If your vision blurs, that's an emergency. I don't want to go blind. They wanted to put Benadryl into an IV to help the reaction. However, I'm a hard stick in the best of situations, and allergic reactions tank your pressure and make it hard to hit a vein. I had needles wiggling around in my arms about 5 times in the middle of the night while I was actively suffering from anaphylactic shock. I just had enough, lost my mind, started sobbing, and refused to let them touch me again for about 20 minutes. Mid-attack, I said, "I'm sorry, I'm usually much calmer, I'm just scared," and thanked them for helping me when they did finally find a nurse who hit a vein and started the IV. Threads like this let me know that because I was genuinely having a medical emergency, wasn't screaming or swearing, I did eventually calm down and let them do it. I was not nearly the worst those people had ever seen. It makes me feel a little better about it. Story 41. This was not while I worked in the ER. It was when I was pregnant and I had to go in for a gestational diabetes test. I had the initial test, and while I was waiting for the sugary drink, I saw a girl hiding from the nurse, eating toast and drinking a bottle of Lucozade. I was shocked. Then I went downstairs with my mom, where my mom ate a full English breakfast. While I was sitting there, nil by mouth, the same girl sat down near me and started eating a full English breakfast. I thought to myself, seriously, do you not care about that child? Story 42. We often see patients in the ER who demand tests or diagnostics for chronic illnesses, even though they've already seen every specialist in town. For example, a patient might insist on more procedures even after a gastroenterologist has scoped and biopsied without finding a definitive answer. The ER is not going to be able to cure you today. The medical specialty of the ER is emergency medicine. It's even written on the side of the building. We're here for emergencies, not chronic conditions. Story 43. I'm not a doctor, but I gave this advice to one of my sisters who's a nurse. I simply told her that if a parent refuses a child's immunization, she should ask if they would be willing to subject the child to an allergy test. The idea behind this is to see if the parents are willing to prove the justification for their objection. She gave it a try and discovered that a couple of parents were clueless about their beliefs regarding their child's health. She only had a few cases where the refusal of an immunization was medically justified. I later learned that it is a common psychological tactic for doctors to determine if they are dealing with a competent parent. Story 44. Putting very much departed relatives in a car instead of calling for an ambulance creates a dangerous situation for everyone. Paramedics and firefighters are much stronger than ER staff. In these situations, I have to go find a gurney and call for help, and by that point, we're starting CPR in the back seat. It is far from ideal. About 6 months ago, I remember a family member telling me that I needed to get a gurney ready for his father because he hadn't been feeling well on a trip to Las Vegas. My hospital is in Los Angeles. They drove for more than 4 hours to get him back, and he just got worse and worse. It took 3 of us to haul the father out of the car and onto a gurney. My tech was almost hit by another car in the parking lot while we were dealing with this. I understand that people don't want to deal with a huge ambulance bill, but that situation was so dangerous for my staff and ultimately the patient. He was oxygen deprived for too long and had a bad outcome. Story 45. I'm not a doctor or a nurse, but I work in a hospital. I try to give people the benefit of the doubt because, after all, it is their emergency, not mine. However, people seem to overlook basic decency. If you cough, at least attempt to cover your mouth. It's not a good idea to walk around barefoot in the emergency department. I promise we will give you socks. If you have pink eye, maybe don't walk around touching absolutely everything, and please stop rubbing your eyes. Story 46. The number of people who take the path of least resistance and pass away from it is disheartening. We often see patients who are fully capable of doing things for themselves, such as a person ringing their call light to ask a nurse to hand them a glass of water from their bedside table. This behavior, when done consistently, worsens the effects of long-term immobility. Patients who come into the hospital mobile leave needing a lift assist device, ruining their lives and skyrocketing the resources needed to deal with their care. Keep moving, everyone. Move as much as you can. Story 47. As a former lab tech, I have a tip for anyone with an elderly relative. If they start acting paranoid, insane, or forgetful and turning off their internet for a few days doesn't help, please take them to urgent care and demand a urinalysis. Quote-unquote weird behaviors are often the hallmark of a urinary tract infection, UTI, in an older person. They may not be able to feel the burning sensation or bladder, kidney, and flank pain because of other ailments or pain medication. More often than not, erratic behavior is the only sign of a UTI in its early stages. And if any of these stories got to you, here's more for you. YouTube thinks you're going to love this. I'll catch you in that video.